Hi, welcome to today's episode of my pregnancy journey with Dr. Sikolia. Today we'll be discussing about two common but very serious symptoms that one can experience during pregnancy, and that is pain and bleeding while you're pregnant. So any form of bleeding during pregnancy should be taken as abnormal. So once you've conceived, ideally you shouldn't bleed. You should not get your periods, and you should not experience any form of bleeding, whether it is spotting, in which case maybe you see some spots of blood when you wipe, or whether it is blood pouring out, either little or in clots. All that is not normal and should not happen during pregnancy. So there are various reasons why someone will bleed during pregnancy, and these range from very small or subtle causes to very dangerous. So I'll start off with the commonest, which usually is bleeding could be caused by infection within the vaginal area. So you find you have either an infection there, like yeast infection, which will then cause inflammation, that is swelling around that area, and then you find that when it comes off, you experience some spotting. You could also have bleeding just because of the changes in pregnancy. When you get pregnant, your cervix is softer, and there's a high chance that it could bleed when, say, it is touched or if something comes in contact with it. Then going further up, you could bleed because the pregnancy is threatening to come out. So a miscarriage maybe is taking place, and that is in early pregnancy. So what happens is because the pregnancy is detaching from the lining of the womb, that place where it comes off or peels off then starts to bleed. So that is a very serious sign of the pregnancy coming out. You could also bleed because there is a problem with how your placenta is located. So ideally the placenta should be away from the opening of the womb, that is the cervix. So if you have the placenta closer to the cervix, then there's a high chances that you could bleed, and this can happen when the cervix starts opening, or when there is some form of insult to the cervix. Then the other cause of bleeding from the placenta could happen when the placenta detaches prematurely. So ideally the placenta should detach after the baby has come out, but due to many other factors, the placenta could start detaching prematurely, what we call placenta abruption. So that could cause severe forms of bleeding, usually with a lot of pain to the tummy. Then the commonest cause of bleeding usually is during the labor process, so what we call show. So when you're about to go into labor, you may experience some form of bleeding. A mucus plug comes out, which has some blood on it. And usually this is because the cervix is opening up and preparing for the baby to come out. So those are the commonest causes of bleeding that can happen during pregnancy. Bleeding can occur anytime during pregnancy, but we commonly see it during the first trimester. There is what we call implantation bleed, so to speak, which happens commonly in the first few weeks of pregnancy. Shouldn't happen, but it is a common thing to see that in the early stages of pregnancy, when it's starting to grow, some women may experience some bleeding, which either is seen by blood coming out, or it can be picked up during the routine ultrasound. But later on, then these episodes of bleeding become less. So any bleeding happening after that period usually most of the time would be a sign of things not going well. When you experience any form of bleeding, it's important that you are seen by your doctor or a healthcare provider to assess what is causing the bleeding and whether the form or amount of bleeding that you're experiencing is dangerous and warrants immediate intervention. So any form of bleeding during pregnancy should be reported. Now, the issue of pain is quite broad, and it's very difficult at times to know what is normal and what is not normal, because a majority of women will experience some form of pain during early pregnancy. Some may experience it throughout, and others may experience it at different stages of pregnancy. So at times it could be normal in that nothing, it does not signify or indicate that there's anything serious happening. For instance, in the first trimester, you could experience pain as a result of the ovary where your ovulation took place. The place where the egg comes from actually leaves behind a scar and what you call a cyst. And actually this produces hormones that support the pregnancy in early pregnancy. So that cyst can actually cause pain in some women. Or there are changes that happen due to the hormones. Your bones become a bit softer, the ligaments become softer, and you experience pain during early stages of pregnancy. As the womb grows and becomes bigger, it also puts a lot of strain and stretches to the muscles, to the ligaments around your body, and you may experience pain. And then as the pregnancy advances, the pressure of the baby on your bones could also cause you to experience some forms of pain later on in pregnancy. However, most of these pains I'm talking about will respond to simple measures like rest, taking fluids, or taking simple painkillers. If the pain does not respond to simple measures or persists or keeps getting worse with every hour that passes by, then you need to take that serious, and that needs to be checked out to exclude any abnormality or any danger that could be happening to your pregnancy. So what are some of the things that could cause, that could signal that the pain you're experiencing is serious? One is if the pain is persisting and it's getting worse. So we see this commonly in people who are getting premature labor. So it could mean that you're going into premature labor, which is not something that you want. And if that is the case, then that should be stopped. It could also signal an infection, and the most common being the infection of the bladder. So if you have a urinary tract infection, your bladder gets inflamed, and then you experience pain in the lower tummy. And then it could also mean that probably there's an issue with the placenta. So if the placenta detaches, for instance, what you call placenta abrasion, you could actually experience very severe pain. In those people who've had previous surgeries, like removal of fibroids, they've had previous cesarean section, actually pain could be the first pointer towards a problem happening in your womb. Maybe your womb is overstretching and the scars that you have or you had before are giving way. Then in our population, there are women who go into pregnancy with what you call fibroids, and fibroids are some growths within the womb that are usually of various sizes. So what happens during pregnancy is because of the increased blood supply to the womb, these fibroids tend to grow very fast when one is pregnant. And as a result of that fast and rapid growth, then people could start experiencing very severe pains during pregnancy. So in a nutshell, those are some of the common causes of pain during pregnancy. The pubic symphysis pain is a form of pain on the lower part of the tummy, what you call the pelvis. So the pelvis is formed of two bones that join at the front. Yeah, so they join at the front of the at the lower part of the tummy, and they are separated by soft tissue in between, what you call a ligament. So what happens during pregnancy, because of the pressure of the head or the baby on the pelvis, you could have that bone stretching apart. So the baby, as the baby grows, the bones now start stretching and going apart, and that leads to severe pain around that area. Sometimes it can separate completely, and this causes very severe pain to the extent that it can actually immobilize the patient. So if the pain is so much, the pelvis becomes unstable, and one is unable to walk without support. So in that case, we either put you on crutches or put you in a wheelchair, because standing unsupported will actually put much more stress on the pubic bone, and that will lead to further widening or even fracture of that bone. So that is a special type of pain, commonly, not very common, but can be quite disabling during pregnancy. So remember, any pain or bleeding during pregnancy should not be taken lightly. So I'll advise that you've experienced any of these two symptoms, then you need to be checked first before you assume that what you are experiencing is normal or is part of pregnancy. Thank you for watching us, and I hope you found this episode educative. If you did, please leave your comments or question in the comment section below. But also remember to share and subscribe to our channel.